First of all, I'm grateful to Mrs. Andrea, the biggest advocate for ALS patients by the Society of Dystrophy of Slovenia, for the invitation that today we can present the history of ALS team in Slovenia. While last month, ALS team was approaching 20 years of organization. Thank you, Andrea, for introducing me to the audience. The idea to organize integrated care for patients with ALS has begun in 1997. At that time, I have been familiar and alert with ALS by neurologist, Dr. Janez Zigar, who has treated people with neuromuscular disease. The idea has been immediately put into the practice into the practice, and in 1997 we started actually tried to treat the patient with ALS holistically. A person with his own medical history, desires, values, family situation, social circumstances and lifestyle, what play into his experience of health condition or disease. Firstly, we started the discussion to ourselves. I remember that at the time I was in the role of nurse, of dietitian, speech therapist, psychologist, and etc. Depending of the course of progression, ALS disease can be a parable, as for vortex as for spiral. Usually one problem is followed by the second and third, and to take quick action is required. Patients and their relatives usually find it difficult to adapt to rapid deterioration. Quick action means the organization of established routes of medical care and assistance in order to be able to at least partially alleviate the patient's problems and concerns. What is relevant today may not be necessary in a few weeks or months. For example, electric wheelchair. In October 2002, it has been formed organized patient care with a group of professional colleagues known as the ALS team. At the same time, within the framework of the Society of Dystrophy of Slovenia, patients with ALS have organized themselves into the ALS committee. At that time, there were 2 neurologists, a speech therapist, a hospic, a pulmonologist, a gastroenterologist, representatives of the ALS committee, and myself as a social worker and coordinator. Over the years, more and more professional colleagues have joined us. At the beginning of the organized system, we set about creating protocols. Nowadays, the ALS team covers outpatient hospital activity. The patient is usually referred to a neurologist by his personal physician, usually followed by a diagnostic procedure. The next step is communicating the bad news or talking about the illness. It's usually a family gathering. We offer patients the options of further treatment in our team of ALS. Usually, checkups, frequency or re-examinations are on average on every 3 months. During the comprehensive treatment, we also cooperate interdisciplinary with experts from outside of our institution. We advocate a palliative approach to a holistic treatment. As the disease progresses, we also take care of feeding and breathing problems. If necessary, in these cases, patients are also admitted to the hospital treatment. Patients and their relatives can always contact the coordinator of the ALS team. The team approach enables timely identification of problems and quick action. At the same time, better care reduces the number of hospitalization and improves the quality of life. In 20 years, we treated over 740 patients, of which approximately 390 were men and almost 350 were women. So the number of new patients increased yearly by about 30 in recent years. The average years is 65 years. So a review of the availability and organization of ALS medicines. In 1998, 5 patients have been allowed to participate in research with the medicine riluzole. 7 years later, in 2005, Slovenian patients have finally got the rights to the medicine riluzole. At that time, it was called Rilutek. Later on, there was the competition with Sclerosis, and in 2020, the possibility of the medicine in liquid form Teglutik, which made it easier to care for patients with swallowing disorders. In 2021, our health insurance company supports our request for a new medicine against ALS disease, namely phenylbutyrate, Hemonaps or Ravicti, which patients today can get after applying for it.
Sorry to interrupt you, Dr. Stanislava. Can you maybe try to press F5? Maybe we can then see the whole screen. Our IT guy said that if you try to press F5 from your keyboard, it may work.
This? Sorry.
You did. Yeah, no problem.
Sorry, thank you. Thank you. Yes, thank you. For the treatment of spasticity against spasms and against excessive salivation in the pharmacy of the University Medical Center of Ljubljana, we have provided, arranged the availability, the medicines that are not covered by the health insurance company. So we have also arranged accessibility to some customized medical devices and interventions. At the beginning of our treatment, we were able to help patients with breathing disorders with CPAP devices. And in 2006, we have started using BiPAP devices for breathing and later on even respirators. Sorry. We agreed with the Rehabilitation Center for customized neck braces for patients with communication difficulties. The insurance company arranged for the rental of a replacement communication device. We have also made sure that patients get priority to access customized peroneal braces. In 2003, we have asked for a wheelchair to be rented. In the same year, we also took care of the speaking program, which facilitates communication for patients who were left speechless. In 2007, we have asked the Society of Dystrophies for a co-suppressant to lend it to the patients. In the case of swallowing difficulties, we solved the problem with the classic insertion method of PAG. Nowadays, the feeding tubes are designed with more modern, easier procedures for the patients. It is also a novelty that our mobile ALS team can change the feeding tube if necessary, that the patient doesn't have to go to the hospital. So other activities of Team ALS. In 2004, we have published a leaflet about the disease. In the same year, the clinical psychologist has organized a monthly meeting for caregivers and relatives of ALS patients. We have connected to the Golnik Hospital, which organizes education for relatives in case of decision for invasive ventilation. Yearly, we send notification to patients about vaccination against influenza, pneumonia, and against SARS-CoV-2. We wrote the criteria for admitting patients to the hospice house. We wrote we are involved in the Butterfly project, which follows a palliative treatment approach. In 2020, the health insurance company has approved home visits for those patients who are in the last stage of the disease and an artificial ventilation. At the beginning of its activity, the Committee for ALS published the newsletter Lastovka Follow, where we are participate with our contributions. We were also guests on Radio Slovenia, and the show about ALS was hosted by a journalist who also has diagnosed ALS. If you remember, worldwide, known Ice Bucket Challenge in 2030, we also doused ourselves with ice cold water in Slovenia. At the Slovenian Book Fair in Ljubljana in 2006, Mrs. Andrea and me were guests at the release of an autobiographical book written by a Swedish journalist who lived with ALS disease. In the same year, we were guests at the publication of a book in the Forum of Diary and Tries of an ALS patient who had already died. In 2021, we participate to the first manual on palliative care in Slovenia, which was published. Otherwise, our colleagues are very active in researching and writing scientific articles related to the ALS disease. For better recognition of the disease, we also organize lectures in retirement homes, general hospitals, and colleges. In 2017, the European ALS Association has organized a meeting with a symposium in Slovenia. Professional colleagues in the team also carry out many researches where patients are involved. Professional colleagues are also receive additional training on a regular basis. So, as part of the ALS team, we had also managed to organize 2 one-day trips. At the end, there are wishes of our ALS team. There are certainly many of them, but I would like to highlight 3 mains. Increase the database, which is currently only medical. The second is update the website, and the third is telemedicine. This is the conclusion of my presentation. Thank you for attention.
Thank you very much for this presentation on integrated care for ALS patients and for your experience over 20 years in caring these patients. I would like to open now the floor for questions and comments, or do you have any questions? I'm looking for raised hands. You can unmute your microphone and ask questions. If not, I would have a question. How difficult is to ensure coordinated care for these complex conditions like ALS? How difficult it is to organize this care and to bring together all the professionals to bridge the gaps between social, medical, and educational services, because you are talking about social services, medical services, but also trainings and so on. How difficult it is to organize this?
This is difficult. Yes, I don't know how to organize, but I have good colleagues who is I don't know.
Do you have some case managers, for instance, people that help people?
No.
Okay.
No managers. I and Dr. Zidar is a main in this team, and colleagues work with us. I is non-stop, is always in the ambulance with neurologists, and this is the catch how I can make this work.
Yeah. Okay. Do you have any questions?
Dorita, there is a question in the chat from Dr. Raul. He's asking if is a radiological intervention of any help to ALS patients. So if you use radiological intervention.
Yes, we use, but radiological intervention work, radiological doctor for example, which when we need to make a PAG,